welcome to another episode of the Pink Pill podcast. And today I have with me the most famous plastic surgeon in Bangalore, Dr. Karishma. Welcome.
Thank you so much.
Thank you so much for coming.
That's too sweet an introduction.
No, but it's true. And it's been a long time waiting. I've been wanting to interview you for a really, really long time.
Thank you so much for having me.
Yeah, thank you. So, do you want to tell us a little bit about yourself?
Well, I'm Dr. Karishma Kabod. I'm a board certified plastic surgeon, and I have my own daycare center, Dr. Karishma Aesthetics in Indranagar, as well as in Whitefield in Bangalore for the last 5 years. And I've been practicing for more than 13 years now.
Wow.
As a plastic surgeon.
That's amazing. What do you think makes a good surgeon?
A good surgeon. So I think this is something I thought about, inspired by my mom, who wanted me to be a doctor. To be a surgeon, I feel it requires us to be, of course, intelligent,
Right.
professionalism,
Right.
courage,
Oh, wow. Really?
and then creativity,
Mm.
and then perseverance. I think all of these skills, or what you say, are more important than just the dexterity of a surgeon, which could differ from surgeon to surgeon.
Right.
But I feel a surgeon needs to have this constant persistence and perseverance to keep upgrading themselves, keep learning new skills, new techniques. Now we're talking about healthcare at the end of the day, and all of healthcare revolves around medical science and technology and upgradation.
Correct.
So I think as a surgeon we have to keep upgrading ourselves.
Right.
I will have to keep learning, teaching and learning
Correct.
all my life to keep being up to date and being the best. And being a surgeon requires a lot of hard work, and as I say, persistence and perseverance, and there's no end to learning as a surgeon.
Wow. And when it comes to plastic surgeons, do you think there's a difference? How do I choose the best plastic surgeon for myself?
I think the word, creativity, I think holds best for a plastic surgeon.
Okay.
I think whatever we do, whether it is trauma surgery, reconstruction, treating burn surgery,
Right.
burn patients,
Yes.
or the cosmetic aesthetic surgery that I do more these days. At the end of the day, it is creativity put into skill. It is art and a little bit of craftsmanship and the dexterity of the hands.
Right.
And I think that fine dexterity comes with being a plastic surgeon.
Right.
So I chose this field because I felt that I had all of these qualities in me in terms
Right.
of creativity, the skill, the dexterity of my hands.
Right.
And I felt I had a keen vision towards aesthetics. I mean, the beginning of my career, I did not do too much of aesthetic surgery. I was doing more reconstructive surgery,
Right.
trauma surgery.
Right.
And it's only after I decided that this is where my interest lies. I did multiple fellowships abroad, trained more in purely cosmetic plastic surgery.
Amazing.
And I think that's when I decided I'd really have the skills. And that's when I opened my clinic, Dr. Karishma Aesthetics, and brought all of my training into existence.
Wow. So, do you think I should go by reviews online, or should I ask my friends, or should I check what kind of degrees they've done when I go to?
Yes, I think, the third point, what you said,
Should be
is
first.
most important.
Right. Right.
I think research your plastic surgeon.
Okay.
So, see, a plastic surgeon, as I said, could be doing reconstructive surgery,
right.
could be doing more of aesthetic surgery.
Uh-huh.
So, it's very important when you are looking at certain plastic surgeons like me. My interests are body contouring, rhinoplasty, breast surgeries. And when I say breast and buttocks, includes the whole body contouring.
Okay.
So I'm more passionate, face lifts,
Right.
neck lifts,
Right.
the nose jobs. And I think I specialized myself beyond being a plastic surgeon. We further super specialize and do these fellowships in those particular genres of surgery. I would say instead of genres of music, genres of surgery. And so I feel a lot of my patients who come to me, actually, to be honest, patients from abroad also come. They said, we researched your website. We read about you.
Right.
We saw where you have done your training. And we said, okay, we will go to that plastic surgeon for that.
Right.
So it's basically, I think to choose your surgeon is important. So you research your plastic surgeon.
Right.
Make sure they have the degrees which are needed to be a qualified plastic surgeon. You have to complete your medicine degree, MBBS, which is 6 years.
Right.
We then complete our master's in general surgery. And then I do my super specialty MCH plastic surgery.
Oh, you've
or
done
a
your super
DNB.
specialty.
Yes. So you cannot be a plastic surgeon till you finish your general surgery. So you do your master's in surgery, the MS, and then you do an MCH or DNB plastic surgery. And that is what a plastic surgeon is. So if someone is saying, I'm a cosmetic surgeon, you have to be a plastic surgeon to be a cosmetic surgeon.
Oh.
You cannot be a dermatologist who does aesthetic dermatology and skin and say, I'm a cosmetic surgeon. Oh, there's a very clear-cut differentiation. When you're doing surgery, you are actually operating on the person.
Right.
You are transforming features,
Right.
not so skin treatment. So in our clinic, we have dermatologists doing cosmetic dermatology.
Right.
That is aesthetic treatments on the skin. So they are a cosmetologist. I would call them cosmetic dermatologists because they have done their degree in dermatology. Then again, specialized in aesthetic skin treatment.
Right.
There are a lot of dermatologists who do medical skin diseases. Same way, there are plastic surgeons who are more experienced in reconstructive surgery, cancer surgery, burn surgery, trauma. It could be hand reconstruction. So say tomorrow, like the initial 6-7 years of my practice, I was purely doing reconstruction. Now I'm doing purely aesthetic surgery.
Right.
So I feel if someone is looking for, sometimes I get certain patients, I have to do certain reconstructive surgeries. The ones that I know that I am most trained in, I would do it. If I feel there's another plastic surgeon, a colleague of mine who does it better, I would rather refer, because I feel it's also, for me personally, that ethically makes sense also.
So you're saying it's best to go and research about the doctor.
Research about the plastic surgeon. Google reviews are, there can be, as a human being, you can't make the whole world happy. You cannot. No one can. Right?
Yeah.
So reviews to an extent.
And they can also be bought. Nowadays, that's also happening.
That happens. But I think reviews is the last thing. Yes, it does matter. But I honestly believe my practice picked up through word of mouth.
Right.
And it was always someone, if you have done something good, and, there's always like a friend referred me, or a family person or someone who knows you, a doctor could be referring another patient to me. And then, of course, please check, are they certified plastic surgeon?
Okay.
Do they have the MCH DNB degree in plastic surgery?
Does that happen?
You need to research when you are going to that plastic surgeon.
But there are people who might claim to.
Possibly.
Possibly. All right. So you said you should ask your friends, or you should talk to people. But do you feel that there is a lot of taboo in India about agreeing to the fact that you've done plastic surgery?
There is a lot of segments of our country.
Right.
There are still people who are orthodox, do not want to talk about procedures that are done. And you would be surprised. You'd be standing in a social crowd.
Yeah.
And everyone, maybe there could be people who have done some procedures.
Yeah.
And would not say about it. Sometimes they would be talking negative about it. And
really?
Done it. We see all of this. We observe, we think. But I guess we cannot stop that from happening.
Yeah.
But yes, I think people need to know it's high time we break the taboo.
Yeah.
It's become a household word. Plastic surgery is not something great or fascinating anymore. I mean, there was a time when it's, became really rampant, was the 80s, the early 80s, where Hollywood, whether it was, Baywatch, Pamela Anderson and her breast implants. And, so the late 70s and the early 80s is where cosmetic surgery in America became flamboyant with Hollywood, making it so famous.
Yeah.
And at the same time, the medical advancements also started then, because as the demand increases, science advances, and then we get more technology. And as technology improves, our procedures improve, the safety improves. And the way we do the techniques, probably what I have read in my textbook in plastic surgery is very different from what I do, because the technology then and the technology 40 years later is
completely different.
Leaps and bounds.
That's why you need to keep studying.
So that is why we need to keep studying, keep upgrading.
Yeah.
I mean, there's journals and, we need to keep assessing the work that we ourselves do. And keep improvising. Science is all about improvising.
Oh. So you mentioned about breast augmentation. I feel like that's
Okay.
the most taboo.
Yeah.
But
Yeah.
I've met a lot of people in India and Bangalore who want to get it done, but it
Yeah.
just seems like, what are the medical issues? What are the types? Would you be comfortable in telling me a little bit about?
Absolutely sure. I mean, that's my job.
Yeah, and I saw that you were talking about it on your Instagram as
On
well.
my
So
Instagram. So I would tell you, breast augmentation took a while to grow in India.
right,
I would say majority of we were doing more numbers of breast reduction and breast lift,
okay,
or majority of Indian women.
okay,
But as I said, initially it's that Western influence and to do breast augmentation.
right,
But I would say starting 15 years back when I see the start of my practice,
yeah,
and now
yeah.
in the last 3 to 4 years, there is nothing but an upward trend in breast augmentation.
Could you tell me the difference between lift and augmentation?
A lift is basically if the breast is sagging,
Okay,
below the normal position that it should be,
okay,
due to whatever reasons,
right.
we need to lift the breast to its higher normal perky position.
Okay, and that is
Now it
possible.
that is possible.
Okay.
I mean, see, breast is one area of the body. I have just yesterday evening, I was consulting this patient and she said, I have tried every massage, every cream, Ayurveda, homeopathy. I said, unfortunately,
Yeah.
I said, I'll put it in one simple sentence. Unfortunately for breasts, there's a one area of our woman's body which is affected by weight gain, weight loss, weight fluctuations, pregnancy, breastfeeding.
Right.
And unfortunately, there's no supporting tissues in the breast. It's directly affected by gravity, age, and skin stretching.
Okay.
And there is nothing but surgery can fix it.
Mm.
It is an unfortunate truth, fact.
Right.
Unfortunately, I've had women, trainers telling them, no, I will help you lift the breast. You
Build the
do
muscle.
weight training.
Yeah.
Yes, it is important to do that.
Yeah.
You have to give certain stability, but there is a very flimsy attachment to your pec muscles,
Okay.
and the breast tissue.
Oh.
And you could have really strong, like I have met people who are very into fitness, had post pregnancies,
Right.
sagging of the breast. They are into fitness. The muscles are strong. They are exercising, working out. Just can't fix because the breast slides with that overstretching, which has happened during pregnancy breastfeeding. So all your chest presses and all your exercises. I'm sorry, trainers. A point below which breast sagging has to be corrected with a breast lift surgery. Now, during the lift, if a woman maybe has lost all the volume in her breast,
Right.
there are a lot of women after pregnancy lose a lot of weight and breastfeeding.
Right.
And they lose all the volume which they had earlier and it's sagging.
Okay.
So then we lift and add some volume to it, which is either implant or fat.
Okay.
Okay. So that's the choice they can make. If
Okay.
they have enough fat in the body, I can put. Otherwise, unfortunately, they have only one choice, which is a silicone implant.
Okay.
So we have to do the lift. It's basically like a sophisticated tailoring, that we resculpt it.
Right.
We tuck it up.
Right.
And then we fill the gap to make it look rounded with an implant.
Okay. And does this leave scars?
A few minor scars are always left with a few plastic surgeries.
Okay.
We can't avoid the few leftover scars. But I think, I would say with my experience, I've met so many of my patients over the years. They said at the behest of getting and being happy with the feature in my body, I don't care about that damn 1 or 2 lines. And I think the plastic surgeons, we are trained to do those, the stitching of the wounds very finely.
Right.
That is where our dexterity is important. We use very fine stitching,
so it fades away.
Yeah, it fades over time. It never goes completely.
Right.
And there are a lot of treatments we provide them in the first year or so
Right.
post a surgery to take care of the scar. So it's also dependent on the patient, how well they take care of the scar. So aftercare is very important. Following the treatment for the scars, coming to do scar lightening treatment. There are lasers and there are peels that, our dermatologist, I always send after 3 months, scars becoming dark, go to our dermatologist and they start chemical peels and lasers for the scars. So it fades over many years.
Right.
Never goes completely.
Right.
But it's the slight compensation for getting something that you're living with your body.
Yeah. What is the most common procedure that you have noticed that is happening in Bangalore at your clinic?
Liposuction, hands down,
Liposuction.
body contouring,
Mm.
and rhinoplasties, the nose job.
Yeah.
When I say body contouring, it could be just liposuction or,
Right.
of a particular area.
Right.
Tummy tucks for a lot of women post multiple pregnancies. Tummy tuck surgery, very common in India. And in my practice, nose jobs.
Hmm.
These three are the most common. Then comes breast augmentation and breast reduction.
Right. Surprisingly,
Yeah.
breast reduction. Why do you think there's like this
A lot
opposite?
of women, a lot of women suffer from heavy breast. We say, there are young girls also post puberty. There is a medical condition called macromastia,
Okay.
or gigantomastia, which is an abnormal enlargement of the breast gland tissue.
Okay.
No cause.
Oh.
Sometimes it just could be a massive hormone surge happening during the postpubertal age,
Right.
due to which there is a very abnormal, massive growth of the breast, uncontrollable.
Right.
And they suffer, because of the massive size, awkwardness, not even being able to do your daily activity,
Back
pain, neck pains.
Right.
Most of the breast reduction patients, ladies who come, are suffering from one of these symptoms. More than aesthetic reasons, their first issue is medical and functional.
Right.
So when, they are my happiest patients. My breast today, I did a breast reduction.
Oh, really?
Just this morning. She was so scared before the procedure, surgery. She went home today. I mean, just when I came for the podcast.
No.
Yeah. So
it's just
small
like a one
breast
day
reductions
Okay.
are daycare procedures.
Okay.
2 to 3 hours.
Oh.
And she woke up, she had her lunch, just before I came for this podcast. She was discharged and she was like all smiles, all smiles. And the other happiest because, oh my God, doc, you've lifted a weight off my chest. That is literally the standard dialogue. So, why should it be a taboo to do plastics? I mean, it just changes that person overnight.
Yeah.
The person, she's just a new person now.
Right.
And she's just going to feel better. She's going to, wear a better fitting bra,
For sure.
better fitting clothes. She's like, I don't have to, suffer. Already when they come to me, they're already having hunch on their back.
Right.
Already the bra strap marks are there. So, they're already, they're suffering. So breast reduction is very common. And even if they're not heavy, even for just the lift aspect.
Right. Oh, so this lifts up.
The breast reduction inevitably lifts because once I reduce the size, I have to lift up.
Right.
But for breast lift separately, sometimes they're happy with the volume.
Okay.
So we don't need to add volume.
Okay.
Sometimes we just keep the volume as it is. Sometimes we don't even add implants. We just lift the breast, remove the extra skin causing the sagging,
Right.
and leave it as it be. We don't add or subtract anything.
So you also mentioned rhinoplasty. I wanted to actually get a nose job. Do you think people will be able to tell? I know I shouldn't even ask that question, but are plastic surgeons able to tell when someone's got some work done?
Sometimes yes, and sometimes no.
Okay.
Yeah. If you want a rhinoplasty, there should be certain reasons that you want to tweak. It's all about what do I want to change, the feature of that particular area.
Right.
Now, if you want the rhinoplasty, somebody has a crooked nose or somebody has a hump on the nose, there could be a certain feature which annoys them.
Yeah.
I mean, some people overdo it, like, my selfie on the right is better than my left. Now that I cannot change.
Yeah.
Everyone, I'll tell you, people need to know 90% of the population has an asymmetry on two sides of the face.
Right.
And that's why you have your better side and your not so better side.
Right. Yeah.
But you cannot get 100% symmetry anytime.
Right.
No matter how much we try.
Yeah.
And then if we push ourselves to go for that absolute perfection, then we can start doing more and more unnecessary things. And to achieve that perfection, you might make it look too artificial. So I feel you want a rhinoplasty, anyone should be okay, but it should be a valid reason. Like, okay, it's slightly tilted.
Right.
Or you want a narrower nose. I mean, most common thing in India is usually the hump on the
pakoda
nose. Yeah. So either it is a boxy pakoda nose, or it's a wide nose, or it could be a tilted, crooked nose.
Yeah.
Sometimes the hump, girls with the kind of a hump, or like the tip of the nose just drooping down, and they're just conscious about it. Now, what goes on in the mind of an individual? I can never say. I could look at a person and says, why do they want to do
Yeah.
nose job. Sometimes I think, a lot of patients walk in, I would be thinking they want something else and they ask for something else. So it's always an individual desire.
Right. To look a certain way.
It's a personal, doing any cosmetic plastic surgery is like a personal desire. I believe it's so individual and it's in your mind what you feel that you want to live with and not live with. And it is one life.
It is one life. But have you ever had to say no because someone was just adamant on getting more and more work done?
I have said no.
Right.
There is a point where I believe personally, my ethics work in such a way that I believe if it is not required, and if you ever meet a patient of mine, they will vouch for the fact that I've told them you do not need it. So if I have one very regular and old client of mine for many years, she's been doing Botox fillers with me. I can't say names here.
Yes.
If she's ever watching this podcast, she'll vouch. She'll come and she'll say, "Doctor, idhar Botox chahiye, idhar thoda filler chahiye." I said, "Abhi nahi chahiye, abhi to kiya hai. Nahi karo." So she tells me, "Aap hi batao." So if I feel it is looking good, it's looking natural, she's she's into theater and things.
So she
for me, I do not want anyone ever commenting for my patient that she or he looks artificial or overdone. And I don't think any of my patients have ever had anyone telling them. In fact, they have had responses like, "Oh, what have you've done something, you're looking very nice, or there's something different, have you lost weight?" Or, that kind of a compliment is a good compliment.
Right.
And that's when we say, okay, the results are as natural as possible, so that the person doesn't see a drastic change in you and completely changing your profile altogether. Unless the person wants it.
Yeah, of course. But then would you say no? Would you be?
I personally don't like it. Sometimes, very rarely, I would do it, but I always tell them, like, listen, I think this is needed. I don't think this is needed.
Right.
I give my personal opinion.
Do you feel like social media also has something to do with it? We have so many social media influencers and we're talking about people who have got work done and then telling people what to do. What is your opinion on that?
Yeah, so again, it's the young generation of Gen Z right now. I would say I'm seeing a lot of youngsters at the age of just 18, 19 and 20, looking for cosmetic treatments.
Oh, really?
Botox and fillers or procedures.
Okay.
I think in the last 4 or 5 years, the social media influence has been quite drastic. So I have said no to some really young people that, no, I don't think you need Botox. I do not know why you are doing it. And, then I have to educate them. So it's important. See, some of them are just being influenced by what is happening on social media.
Yeah.
So sometimes they're unaware. They just think it's fancy. So I want to do it. No, I think I need it. So that is, then comes the role of a plastic surgeon. And I think ethically speaking, I think as a plastic surgeon, it is my duty to educate them that you need it or you don't really need it.
Right.
I mean, if you look at it theoretically, anyone from the age of 18 to even 90 can do any cosmetic treatment, surgical or non-surgical.
Right.
So I cannot stop them medically if they really want to do it. But if I feel somewhere, I think it's really not necessary, I have had said no. I've had instances they have gone and done it through some other surgeon, come back to me later with problems also. And really, which I've had to fix and then regret. So if I am doing this procedure, I make sure that I tell them all the pros and cons, the advantages, the disadvantages. Any cosmetic surgery especially could need revision touch-ups at a later date.
Right.
And they need to know about it and prepare themselves that if that happens, and be aware about the changes that are going to take place post this surgery. And then, yes, do it with sometimes they have absolutely decided that I want to do it. And
I guess it's a Kylie Jenner effect.
I mean, there's so many.
So many now.
Like, we are all, I would say I'm like my plastic surgery influencer in my own game.
You are.
Some of my, plastic surgery colleagues says, you are only the big influencer of our community. So, I mean, it's just, you can't stop the social media influence.
Yeah.
But I guess social media, when used right, is fantastic. But has its pros and cons sometimes. And people should, I feel, not get so drastically pressured into it, and but also take the good parts of it.
Okay.
Because everyone is talking with a certain point of view.
Okay.
Then do your back end research
Right.
on it also.
Right.
And
But what do generally doctors, or especially plastic surgeons or dermatologists, think about these beauty influencers who give so much advice? They'll be like, "Oh, massage your face in this way, or put this thing." What do you think about that, Jen?
So yes, I think the social media influencers are doing a great job at the collaborations they do, the kind of information they put out. I've learned so much. I have a lot of friends who are influencers.
Okay.
I've learned so much from them.
Oh, okay.
In terms of how your demeanor and how to be on camera.
Right.
And they also show so much of information about so many things, which is great. But when it comes to medical advice,
Yeah.
whether it is dermatology, skincare products, or say, because I think most of the influencers talk more about the dermatology
Yeah,
or skincare, not much of plastic cosmetic surgery.
Yeah.
But if they are doing, usually abroad, there are a lot of influencers doing
Exactly.
Yes.
Yeah.
So a lot of our colleagues in Europe and America, also talk about this same
Yes.
issue.
Yeah.
I feel thank you very much for bringing out the awareness that you do, and the work that you do is amazing. Hats off to it.
Right.
But I would just put a small word out of caution and sort of put a request to some of the influencers
Yeah.
that they should also talk a little bit about safety of what they are talking about.
Right.
The medical product
Right.
or the procedure treatment.
Right.
And always, I think, take a little bit of tip or take some knowledge from the experts. So I feel a caution would be, because people sometimes listen blindly.
Yes.
We have someone coming and putting a wrong skin product for a wrong skin type for ages because I had. So I had, so I believe what the influencer is doing is great. It's helping us. Helping our job. In fact, putting out so much of our material out there and talking about treatments, talking about products, which helps us because clients come to us and ask us, do you have these products? Do you have the treatment?
Yeah.
So thank you very much and amazing work and helping our job by putting the things. But a word of caution would be, we would request, I think all our doctors believe that influencers should put a word on safety.
Right.
Should also always talk to an expert, whether it is skincare, talk to an expert dermatologist. If it is cosmetic surgery, speak to some expert plastic surgeon.
Yeah.
And when they are at the end of their, information, always put out a disclaimer, possibly that the final decision is always with the doctor, and they should meet the experts to get a final word on it. So I think besides that, they do wonderfully, but they should always talk about a little bit about safety and when to do and not to do. See, as plastic surgeons, all of my colleagues, me, my seniors, if you see any other plastic surgeon, we talk about educative information. We also in a way are like influencers.
Yeah.
We are influencing because of what I talk. There are patients who are coming to me to do the procedure.
Yeah.
But there is an overall awareness and education also at the back of it.
Right.
So when to do, when not to do,
Yeah.
why we are doing it, why is it safe, when is it safe,
Right.
what is the recovery. So we are putting a lot of do's and don'ts also, pros and cons, and putting the safety aspect of it.
Right.
So we are creating the education and the awareness side by side. So that's also something I guess influencers can adapt and always have an expert opinion.
Of course.
When it's medical.
Yeah.
Yeah.
I mean, but so you said there have been Gen Zs who are 18, 20 who've come to you, which you feel is too young.
Yeah.
Is there an age beyond which you think, okay, now at beyond this age, it's okay for the person to decide, make their own decisions?
No, I think above 18, you can definitely make your conscious, informed decision.
Right.
As long as I have done my role in giving you the right amount of education and awareness about that procedure, you can take a conscious, informed decision and do it.
Right.
Again, when I talk about, I'm always skeptical about rhinoplasties and nose jobs.
Okay.
Because the nose is such a delicate area of the body.
Yeah.
And I always say, boy 21 plus and a girl 18 plus, that's the right age to do a rhinoplasty, especially.
So the earlier the better?
Would you know? You should be 18 plus for a girl and 21 plus because boys are still developing. The whole body and skeletal structure of the body is developing till 2021.
Right.
Whereas girls, we're pretty much we have our full development by the age of 18,
Okay.
even the nose. So
Okay.
18 plus is a good time for like a nose job, and 21 plus for this.
Correct.
Botox and fillers, I always feel you should be 19, 20 plus at least.
Right.
But as I said, I'm saying over a decade in my practice. When I started my practice, there were men and women in their 30s, 40s even, starting the Botox fillers. Now they are starting in the early 20s.
Is it better to start Botox earlier?
I say if you are starting, start with very, very minor amounts and minute amounts, and only if it is really needed. If you really have, see, why do we do Botox?
Yeah,
It's
I
for
was gonna ask you.
wrinkles.
Yeah,
I mean, if
people
you
even
don't have wrinkles,
Indians have lesser wrinkles.
we develop wrinkles quite later.
Yeah.
In fact, we have much more thicker skin, rigid skin. We don't age as fast.
Yeah.
So unless a person is genetically prone and really has
Right.
wrinkles,
Right.
then otherwise I don't think an 18, 19-year-old needs Botox. Yeah.
Right.
So I think they can do, there are a lot of body procedures, breast augmentation. A lot of girls do at 20, 19, 21.
Okay.
Some of them who are possibly so conscious, self-conscious about really small breasts, like,
Right.
I think some of them go through depressive phases. And I think medically speaking, sometimes we believe that
It'll be better for them.
it would be better for them. And sometimes I do send them to counselors and psychologists who can talk to them, understand their mental frame. We as plastic surgeons need to know there could be someone suffering from something we call body dysmorphic disorder,
Right.
where, they do not know, but they're consciously always thinking something is wrong
Yeah.
with them. So we need to rule out that particular factor
Right.
of body dysmorphia.
Right.
They have any eating disorders like anorexia, bulimia. They are going through depression. These things are very important for us to note, because sometimes we do the procedure and they could never be happy.
Then they just keep wanting more and more.
So, it could be trouble for them as well as trouble for the doctor. And sometimes I think some people have really done their research. They really know what they want, and this is something they're not able to live with. And then I feel it really makes sense when we do the procedures. They have this whole new level of self-confidence, which is amazing. And it's not just about vanity. It's really about self-confidence.
And it's okay to care about your looks, right?
Yeah, it's okay.
I mean, we put on makeup for the same reason, right? Yeah.
It's exactly.
Yeah. You want to look good.
We want to look good.
Yes.
You want to wear a particular outfit.
Yeah.
People want, we put makeup to
Right.
look our best. And so why not the body? So we would like to take care of our body and everything else. And it's okay if the person believes that procedure can make them feel confident inside and out.
Right. And I'm guessing maybe because of social media now, do you think they've developed more body dysmorphia because of that? Because they're constantly looking at themselves in pictures.
There could be certain worst case scenarios,
Yeah.
and there could be certain people who are going to the extremes.
Right.
And, as you said, the Kylie Jenner and the Kardashian, and it all started with that and having that perfect body.
Right.
And that's when Brazilian butt lifts became so famous in India. Now
Oh, is it?
they are on a rise.
I thought Indians generally have like a bigger.
No, so
around
as
the head.
as I said, there are a lot of women who suffer from, not a very good structured butt area.
Okay.
They could, they really could have, something we call hip dips and a very manly looking hip structure.
Okay.
For women, in Indian women especially, you want a little curve, not that. But they are genuinely not able to even pick up a pair of jeans for themselves.
Okay.
When I say a Brazilian butt lift or the BBL, that doesn't mean they want like a Kardashian.
Right. They just want more.
They just want some form. It's like I'm wearing a pants from the men's section because I have, there's literally nothing, and it looks so awkward that I cannot wear shorts, I cannot wear pants, and so it's not like giving them a massive Kardashian butt, but it's just filling up a right volume, just enough for them to have some proportion to the rest of the body.
Right.
So when we talk about contouring, it's not just extremes; it's also sometimes reconstructing, I would say, or restructuring a particular area of the body so that it looks coherent with the rest of the body.
Understood. Yeah.
Right?
Got it.
So it doesn't have to be
doesn't have to be a massive butt.
but it can be a symmetric butt.
Yeah.
It could have a symmetric shape to his or her profile. I mean, we do, even for transgenders, I do a lot of transgender surgeries where a trans woman, wants to convert, is converting from a male
Right.
to female.
Yes.
So the trans women would like a more feminine silhouette.
Right.
So for that, we do the waist shaping, the fat removal with liposuction, and then add a little bit of, fat around the hips and the
nice.
slight butt to give them the feminine appearance.
What do you think are the biggest misconceptions about plastic surgery? Because I know there are a lot, and I'm sure you must be bombarded with questions, but what are the most common misconceptions that you've heard?
Most common that will I die? Will I die if I do cosmetic surgery? Because one death was reported 10 years back and 5 years back, and it's a very unforeseen, death which happened. And I think people should not be scared of plastic surgery in general just because of a death which was reported. And the most common thing people are scared of,
Right.
will I wake up after plastic surgery? Is it dangerous?
Is it?
It is not dangerous.
Okay.
Absolutely not.
Right.
I do plastic surgery every single day. It's absolutely safe if done with the right experienced plastic surgeon
Right.
under the right setting in a proper clinic. Certified, not just surgeon, but a certified clinic with a good operating theater, good facilities in the hospital and the clinic.
Yeah.
And if it is a trained surgeon with a sound facility, I think it's absolutely safe. And a rare possibility of a death, I think the last 2 decades, there were 2 major incidents reported.
That's
And
it.
there are millions of plastic surgeries, cosmetic surgeries happening every single day. So can we term logically cosmetic surgery is dangerous?
Not at all. I
mean-
had no idea.
Yeah.
Oh.
Yeah. And people are still stuck on those 2 incidents over the last 2 decades. So I feel, imagine the numbers of procedures happening each and every day in our country. And just so you know, in 2023, the global survey done by the International Society of Aesthetic Plastic Surgeons
Right.
reported India within the top 10 countries of rising numbers in cosmetic plastic surgery.
Oh.
So no more that people are going outside the country and doing cosmetic surgeries.
Yeah.
I think Indian plastic surgeons are well trained. We have our national societies. We have good educational platforms like the Indian Association of Aesthetic Plastic Surgeon, which I'm an active member of.
Right.
I'm also an active member of the International Society.
Yeah.
And all the certified surgeons, I'm going to go back to where do you find your plastic surgeon? On the international and national society bodies.
Okay.
So these are the authentic bodies. The Indian Association of Aesthetic Plastic Surgeons, the International Society of Aesthetic Plastic Surgeon, or the American Society. These are 3 very, very big bodies in the world.
Okay.
And you have the global leaders in aesthetic surgery on these platforms.
So I should go there. I should go online.
You should visit. These are national society.
Yes.
But these societies have their website, like the Indian Association of Aesthetic Plastic Surgeon.
Okay.
You can find
the names
of
the
the plastic surgeon there. Say if you are in Bangalore, then you can go on to visiting. Say there are 10 or 20 or 30 plastic surgeons in Bangalore, and you want to find your plastic surgeon.
Right.
Then you individually go on to that plastic surgeon's profile and see what are the kind of procedures that they have more experience in. Some could be having more interests. We plastic surgeons like to have our interests, surgery interests, and what are the main procedures that we perform or where we have had the maximum training in.
Right.
So that's where you can further filter down and find your certified plastic surgeon on your national society. And today we have such a well-built Indian association. We have crossed more than 40 to 50 years of national society. So this is where education programs happen, training happens for young plastic surgeons. And I went abroad and learned from various international surgeons through these societies. So we have and when I opened my center in Bangalore, I was one of the first to launch the latest liposuction device in Karnataka.
Okay.
So what happens is, this is what happens when I learned and I upgraded. And I thought that, our cities should have the latest. And I made sure Bangalore got the latest technology in everything.
Yeah.
So we have all the latest technology. And today in India, and all the plastic surgeons are getting more and more trained in India, having good setups and having all the facilities that any international center would have, and probably better. We are doing it better.
Is it because you mentioned liposuction? Is it true that liposuction is only for obese people or something like that? Or
That is exactly the myth that liposuction is a weight loss surgery.
Okay.
Liposuction is not a weight loss surgery.
Right.
It is only a method of body contouring.
Right. Okay.
So I can only take off stubborn areas of fat from your body,
Right.
make the particular area of the body look thinner, slimmer, or tone looking, but you will not lose any weight on the scale.
So
bariatric surgery is the weight loss surgery.
where you cut out the stomach?
Yeah, I mean, there are various procedures in bariatric surgery where you have to do, you band the stomach or staple the stomach,
Right.
remove a portion of the stomach.
Right.
When you say cut off, people get scared.
Sorry.
But so bariatric can be more scary than me. Like plastic surgery, we only deal with the top skin and fat. That's it. We don't go any internal. Another myth is plastic surgery, you're going right in. When I do liposuction, some of my friends get so scared, like, oh my God, where are you putting that cannula?
Okay.
It's literally 2 millimeters. Or 3 millimeters.
Right.
And it's only going under the skin.
Yeah.
So it's not an internal surgery. I literally lift up the skin and it's like almost me playing a violin, that's all I do. And that's how I remove my fat smoothly, like playing an instrument, So, plastic surgery is not dangerous. Second is, it is not a weight loss surgery.
Liposuction is not a weight loss.
It is not.
So who's the ideal customer for
the ideal person to do liposuction is someone who has a reasonable BMI.
Okay.
Within 25 to 29, 30.
Right.
Has a good lifestyle.
Right.
Is exercising, reasonable, moderate diet. And, is already doing so much of exercise, already working out, but struggling to remove certain genetic stubborn pockets of fat, which is just not going no matter what. Now, that is the ideal candidate.
And then I'll have a flat stomach after that.
It could be anything. It could be arms.
Okay.
Like I have done body contouring on trainers also. They're absolutely fit, fantastic muscle, fantastic tone, muscle bulk, certain area of the body, no matter what, they're unable to get it. It could be hardly any fat.
Yeah, I have literally.
You could be super fit, but like somebody struggles. And, genetically, like South Indians suffer with the, thigh area, hip area, saddleback, hip fat.
Right.
I see a lot of some South Indians struggling with the arm fat, like bulky arm. Like my mom always had problem her wearing a sari blouse.
Yeah.
To be honest, she's no more. But she was one person who pushed me to plastic surgery, and she would have been my first patient because she was 60 and she was hell bent that one thing my daughter is going to do is do my arm fat removal. I could be fat here, but I have to wear my sari blouses, and she was obsessed with Kanchivaram saris. And so I knew I would have had to do her neck lift and her arm liposuction. She had made it very clear. Mm-hmm. I'm just waiting for my daughter to finish plastic surgery. So she was a very motivated lady. And some part of that motivation came into me, and the need to always feel my best, look my best. And there's nothing wrong in it. She believed that I will age gracefully.
Right.
And that's my personality.
Right.
But I can age gracefully and beautifully outside also. So, I mean, someone could debate it, but that's what my mom thought in her generation.
Right.
And she was someone, even, I've seen her pictures in mini skirts in the 70s and 80s and bell bottoms, and always fashion conscious and always, wanting to be the best that she could. And she was always pro-plastic. In my family, we've had a lot of my mom's, our relatives and my family who have done plastic surgery in the 80s. Wow. Yeah. So they all love the fact that somebody in the family is doing plastic surgery. So if someone talks about taboo, the cupboard, the Rao, my mother's family was like the most fast forward family, who have done plastic surgery years back.
Amazing. But actually, I have a question for that. So I'm going to be very candid right now, but I have seen a lot of celebrities who are now in their 70s and 80s, where you can see that there's obvious work done. And I don't know if something went wrong. I don't know if I can name them, but there are a lot, especially international celebrities, where you can see that. So where is the balance? How do you age gracefully, but also make sure that you look good?
I think the key is moderation.
Right.
Anything in life in moderation brings beautiful results. When somebody goes extreme,
Right.
it will produce unnatural results.
Right.
So when we talk about natural results, it's not, see, if it's completely natural, then you should not do anything.
Yeah.
Okay.
Mm.
The idea is to do the procedure so that the person is aging and aging well, and at the same time there is no drastic change in their overall look. So I'll just
Right.
put in, there was a lot of buzz about Madonna
Yeah.
in, I think, last year's Grammys, and where she had suddenly,
Completely.
so if you
Yeah.
notice her aging and the kind of procedures, and you could see the change happening in every one of her pictures.
Yeah.
When you see the 80s and the 90s and we came to the early 2000s, we could see that she had done some filling in her face.
Okay.
And there was an obvious but the fillers that she had done, or probably fat, we wouldn't know whether it's fillers or fat put into the face. There was a time in the early 2000s, whatever she was doing was looking fantastic.
Right.
It was looking fantastic. But I think this time around, I think it was overdone.
Yeah.
And it made her, her look too in the face. So that is something, as a plastic surgeon, I did not want to do.
Mm.
And we plastic surgeons are now striving more and more not to give those drastic looks. And that is where the whole trend towards natural plastic surgery is happening,
Right.
where plastic surgeons are trying to do moderate stuff. And at the same time, our clients are very happy with the little changes. So I tell them, when you want to do fillers and you want to change a particular feature, do it step by step.
Okay.
Like, don't inject yourself with 5 fillers, one shot in one sitting.
Mm.
I've had patients clients who have come and told me, I said, no, I like to do, okay, we'll do 1 syringe or 2 syringes. Let's do a subtle look,
Right.
a subtle change.
Right.
Then after a couple of months, you can always add in a little if you feel you require more.
Right.
So there is a, gradual change happening. And based on the aging process, it could be under eye, dark circles, hollowness. It could be the face. The first thing which happens is we lose volume on the face.
Yes. Yeah.
And then the cheeks begin to get down. You get these jowls.
Yes.
So there are lifting procedures where it can be done, bit by bit, slowly over time,
Right.
and give a good gap in between those procedures.
Mm.
And it will not. I mean, there are certain celebrities, you look at them now at 60, 70, and they look gorgeous. And
Yeah.
they have done
Of
Botox,
course.
but the Botox has been done so fantastic.
Right.
Like, there is still some natural expression taking place.
Yeah.
When I do Botox, I make sure that my clients all have certain natural expressions.
Right.
No one should say that they're
I
looking.
can't move my forehead.
Yeah, I can't. So I ask them, would you like to, we have to ask them, you like to freeze the face,
Right.
or you want movement?
Right.
And accordingly, you can adjust the dose of your Botox. So you
Right.
don't, it's not necessary that everyone has to look artificial.
Yeah.
Yeah. So it depends on the person.
Actually, maybe some people wouldn't know. So I'll ask you, could you just explain the difference between fillers and Botox also?
Very simple. Filling is basically volumizing. We're adding something. So it could be either to give volume to a particular area, or we are rejuvenating, because fillers contain hyaluronic acid.
Right.
And hyaluronic acid is a naturally occurring sugar in your body.
Okay.
Okay. So it's present in all our bodies as a natural sugar.
Right.
It's just been made synthetically into these syringes.
Okay.
I mean, so they're doing 2 things. One, we are adding certain volume with the
Right.
filler, and the hyaluronic causes the rejuvenation. So people see improvement in the skin
And
texture
it's completely
after
safe.
a few weeks. It's absolutely safe. I mean, everyone's doing it.
Right.
It's, as I said, do it to the right hands.
Yeah.
Do it under the right trained doctor.
Right.
And make sure you're going to the right center using the right product.
Mm.
You
Like, I
don't-
have done lip fillers, for example. Yeah.
Right.
Yeah.
So-
And I found it completely painless.
So, I mean, I
Yeah.
think you answered that
Yeah.
question for me
Right.
about how your experience was.
Right.
And you're the person doing it.
Right.
So your first-hand experience should tell everyone that it is safe if you have chosen the right doctor.
Right.
You've done, how you wanted your filler, the volume you wanted.
Right.
I'm sure you would have discussed this with your
Yes. I just got 1 ml, but I've done it. So I've been doing it since 2019.
Right.
So I've done it 3 times, because after a year, I think.
Yeah,
it
it
goes
starts
away.
to go away.
Yeah.
And you keep doing small
Little bit,
top
little
up.
bit. Yeah.
1 ml is usually the basic amount that I also do.
Right.
Sometimes I do less than an ml.
Oh,
So it
okay.
also depends on the person. The person wants, I want really subtle, doctor, nobody should say I've done anything. Nobody in my office should say.
Right.
I said, okay, fine. You know what? So I like to do subtle,
Play around.
I said, okay, I'm just going to do half a syringe. I'm going to keep it. After 2 weeks, we can keep the filler in the fridge.
Yeah.
And then I called them after 2 weeks and said, are you okay? Are you even seeing any change? Because if you do too little, you see no change.
Yeah.
So they said, okay, now you can add a little. So it's always good to give them a little bit of, headway. Once they know what they want, then they'll say exactly, go ahead and, put 1 cc. Or if they really want the total power, some have very thin lips.
Right.
Like really, really thin lips, we have to use more than one.
Yeah.
But that's rare.
Yeah.
And that again, I never do 2 syringes and I do
You
2
take
a month or 2 months apart
to see.
if they want. Yeah. So I wait and watch. And Botox is a botulinum toxin. When I mean toxin, it's not a toxin really, but it's a botulinum which is extracted from this parasite.
Okay. Wow. It just sounds more scary.
Yeah,
the
it's
more
not
you say.
scary, but it's a very neutralized toxin.
Right.
Okay. And where, it is absolutely safe.
Yeah.
And botulinum toxin or Botox is basically a particular company which is allowed to use the word Botox.
Right.
But there are a lot of other companies that cannot use the word Botox on their label.
Okay.
And they use botulinum type. Okay.
Okay.
So botulinum is nothing. In fact, the medical, there are a lot of medical reasons it was used before cosmetic reasons. So it's just nothing but relaxing a muscle.
Right.
So the muscles causing the wrinkles, we are relaxing using the botulinum. And that causes the wrinkles to appear less.
Right.
So it is also used for migraine. So neurologists use it. We would use it for
jaw.
Yeah, that's basically because this particular muscle we call the masseter becomes overtly big for few people. So we relax it. But we would use it for migraine. We use it for people for a condition called hyperhidrosis, which is excessive sweating in the armpits and the palms and the feet. And it's basically over-secretion of, sweat. So you give Botox, we give Botox in the palms of the feet because the Botox is relaxing the muscle around the oil-secreting glands, sweat glands. So the sweat production reduces. So there are a lot of medical uses for Botox. We use this for people who have facial paralysis, who had trauma, who have had, facial drooping or paralysis or a deformity from birth. And we can use Botox to correct the symmetry of the face. So it's not just only for wrinkles. It's various uses. So Botox is relaxing muscle, nothing much. And fillers is volumizing and rejuvenating. It has hyaluronic acid in it.
Actually, I'll tell you about the first time I got fillers. I think for the first 24, 48 hours, it swells up more. And I started crying because I thought those are the lips I'm going to be stuck with. And then I was like, oh my God, I made a mistake. But then it just came down after.
I tell everyone that's the last warning I give. I say, when you leave, when you get up in the morning, please do not call my clinic with a panic attack because no, I don't want the duck lips. I said, you will see it tomorrow morning. Okay. So don't panic. We give you, just keep icing and ice compressors. And I give them these tablets sometimes for a few days if they have a function in few days.
Yeah.
And sometimes we can't avoid, no matter in the best of hands, you could have a small bruise here and there. No matter how gently and, we try to do the procedure.
Right.
So sometimes swelling cannot be avoided, especially fillers under the eyes and on the lips. These are the 2 most sensitive areas where it swells more than necessary. Like fillers on the cheek or for a chin augmentation.
That's right.
They don't swell so much because the areas they have thick skin. So, balances the camouflages as well.
Right.
But under eye skin, lip skin, under eye is like the thinnest skin in the whole body. So it's so sensitive. A bruising and a swelling is expected.
Okay.
So whenever you're doing Botox filler under eye, lip, and if you have a function, give a week to 10 days gap. Because if by chance you experience a bruise or swelling, at least we can give you certain treatments to make it go or make it subside in that 1 week time.
Okay. If let's say I'm completely new to this and I wanted to get fillers, I know it depends on my shape, etc., but what filler is your favorite that really makes a difference to a person's face?
I cannot say a company's name.
No. I think like under eye.
Okay, yes.
Like that. Yeah.
So I like to use a particular company that I've been using for 10 years now.
Right.
And they have different kinds of fillers.
Right.
As a a surgeon, how I choose my filler is basically on the viscosity of the filler.
Okay.
So all of these fillers have the hyaluronic in certain viscosities, thickness,
Right.
gel thickness.
Right.
So the thicker fillers go deeper into the face. So when I'm looking at volume,
Right.
cheek volumization, or I have to do a liquid, like a nose, I have to give a filler to the nose
bump.
to give a height, the bump, or give a height to the nose. Then I will use the thicker filler, called like Voluma. See, I use something called Voluma,
Right.
I would say. Then I use the moderate thickness or moderate viscosity filler for places like the lip, the nasolabial folds, even the thicker filler for chin augmentation, jawline correction.
Yeah.
Then these areas which are the skin is more thinner,
Right.
and you have lesser volume of tissues underneath, I will use a moderate thickness filler.
Okay.
Then something very thin and light for the under eyes. Because it's such a thin skin. You put something thick underneath here. I've had people coming to me with things looking like a sausage roll.
I think it happened with my mom, even though she's a doctor, but I think that happened.
It can happen. It can also happen sometimes if the filler has been injected too close to the skin. It can happen.
Right.
And if the filler was too thick, sometimes it's uncertain. Sometimes you can't predict. Even a thin filler can cause a swelling unwantingly in some people, rare cases. And it's very simple. See, all of these things, fillers are reversible. You have an injection which I can dissolve your filler in 2 days.
Oh, amazing.
Yeah, immediately I injected. It's something like a antidote,
right,
for a filler.
Oh, okay.
So you have an enzyme. It is reversible. Say, too much is done, or something is looking unnatural, or one side is a little more than the other. And we can always do these minor corrections 2 weeks later. And if someone doesn't want it at all, you can just inject the hyaluronidase, we call. It's an antidote to the hyaluronic acid.
Right.
And immediately most of the filler goes. And within few days, all of it goes.
Okay, amazing. Okay, so I actually kind of digressed.
Okay.
You were mentioning the misconceptions, and then I just
there's no end.
Yeah,
to the
but what are your top
misconceptions.
3-4 misconceptions?
Top
that
3
people should-
is liposuction is a weight loss procedure.
Okay,
Cosmetic plastic surgery is dangerous.
right.
And I think the third one, plastic surgery is only for vanity.
Yeah, that makes sense. What about men? Do you see a lot of now male population also coming for?
There are a lot of men who come for actually cosmetic surgery. Yes, the numbers are more and more. But even for skin treatments, there are a lot of men who are now conscious about the skin, the skin complexion, acne, hair fall, especially. So, and we always knew that hair fall and hair transplant was like the most commonest procedure for generations together.
Right.
I think when we thought of men, we thought like only hair transplant. But now a lot of men are coming for body contouring, six-pack surgery, and gynecomastia, something we call like male boobs, is moops, is always been a common problem for years, not just now.
Yeah.
Now it's coming more out in the open and it's being spoken about. But gynecomastia, I think, is the commonest surgery that I do in my clinic for men, which is like an unwanted overgrowing breast gland tissue in men's chest.
Okay.
So, the chest starts looking a little feminine and it looks like you're pointing out.
Right.
And the nipples look puffy and they can feel like a hard lump just growing.
Okay.
And so I think that's the commonest cosmetic surgery I do in my practice.
So it's not that they're
and
fat.
and abdomen. They all want the love handles. Because so the men, the problem is the love handles, and they're looking for the 6-pack these days, and high definition, we call it.
You
high
can
definition.
give them 6 packs.
Yeah, it's like for women, we give them also the narrow waistlines and things. So for men, but that is very restricted for very few. For those men who have a very good BMI, good muscle mass, already toned, and just have this little bit of stubborn fat just not going. It is for those men, not like someone who has a big pot belly. No, no, that's not for you. No, for them, it's like diet and exercise. So we have to really choose. Cosmetic surgery is a very customized approach. As a plastic surgeon, we have to choose our patient and understand what they want.
Yeah.
And then what is reality? And then what are the possibilities? We need to lay it down for them.
Yeah. I can understand. Is there some celebrity that I would have never guessed has had work done that actually has had work done?
Never guess. We can talk about, but everyone's guessing. You know what? Even if they've not got work done, everyone's guessing what they
That's
have
true.
done.
But, okay.
Like Miley Cyrus.
Really?
It's like it's hard for me to tell whether she has or has not. But when I see her Hannah Montana look at
Right.
a recent
Yeah.
award show,
Yeah.
and she has a totally buckle area gone very drastically in.
Yeah.
So I would say, as a plastic surgeon, she's done a buccal fat removal surgery. On the other hand, I would say that overall, her entire physique seems very toned,
Yeah.
and her overall jawline. And if I look at her face in Hannah Montana and now, even the body, when it comes to her muscle definition, her muscle tone of the entire structure, and when someone loses that drastic weight, women, and they get that lot of muscle tone, we do see a lot of the buccal fat going in.
Yeah.
So I'm like, done a buccal fat surgery, or is it just her overall physique and the way she has lost and toned her body has made her buccal fat, area go in that drastically in? So that could be one.
Okay, name an Indian celebrity, a Bollywood celebrity.
Now Janvi Kapoor, she's done a fantastic. The rhinoplasty she's done is for sure. We know she has probably done a rhinoplasty.
Right.
It's very evident with her younger day pictures.
Right.
Considering, see, this is, you see the genetic nose which happens.
Yeah.
Like Janvi Kapoor, rather from Sri Devi starting.
Yes.
Sri Devi did a rhinoplasty. It was very out in the open because in her younger days as an actress, you could see the broad nose. I mean, it was definitely warranted. I mean, professionally speaking, if I had the big nose and I'm constantly on camera, I would do a rhinoplasty.
Right.
It's completely, I think, justified for. So, Janvi and I forget her sister's name. In the latest Archie's movie.
Yes. Even I don't remember it.
I'm
But
bad with names.
Yeah.
Forget names.
Rhea Kapoor?
No. That's I think.
Sorry. Okay. Someone. Janvi Kapoor's sister.
Yes. Yeah. So she also has just in Archie's, and you can see that she has, I think, done comparing her old pictures, because nose is something you can always compare a picture to say, but I think it's beautifully done because her nose was broad. She had a very broad thing, very bulky pagoda, either naak, and now it's nice, long and slender with a beautiful slope. And that's what a good rhinoplasty is, where it's just done and it looks in all profiles so nice. So I love Janvi Kapoor's nose and her sister who was launched in Archie.
Yeah.
It seems definitely that they have done a rhinoplasty. So I think, again, beauty is very subjective and in the eyes of the beholder. Someone could say, oh, her lip job is bad. And someone could say, I like the lip job.
Right.
It's very hard. I think we should stop commenting on celebrities. Let them do what they want. It is, for them, it's profession. For their profession, they need to look a certain way, and they probably want to look a certain way themselves in front of a camera. Sometimes they could be asked by someone,
but why do they deny it?
Well, that is something that no one can answer. Only God above knows. Why do they deny it? But Shruti Hassan, proud of her. At plastic surgeons, we are very happy when someone actually accepts they have done cosmetic surgery. She always talks in her nose also. And again, a beautifully done rhinoplasty. You can see the difference, the before and the, her earlier pictures. And I think she definitely, her face looks so, much better than, the bigger nose than a nice slender nose. So, I'm so passionate about rhinoplasties. Usually the basic rhinoplasty would just be tweaking around the existing cartilage and bone and moving it around and redoing it. But here there was no cartilage and bone. It was just the nose was in. So that time that's what we called a secondary rhinoplasty, where we have to use a cartilage from somewhere else in your body, which is usually the rib. So the rib has a bone and a cartilage segment, and it's the only cartilage which is closest to the cartilage in terms of feel for the nose, and can be used safely in the nose. So 6 to 7 hour surgeries these take, where I rebuild the actual structure from the rib, make it into the shape of the cartilages which are supposed to be in the nose, and then we fix it and we build it.
Amazing.
And that's the actual nose reconstruction. So as I say, cosmetic surgery or cosmetic plastic surgery is also like reconstructive surgery. At the end of all the reconstruction, even if I'm fixing someone's hand, I'm fixing someone's a child with a birth deformity who's got a gap in the lip, something we call cleft lip.
Yeah.
Even if I'm doing reconstructive plastic surgery, at the end of the day, I want to give that child an aesthetic looking lip when they grow up.
Yeah.
So my primary objective, reconstruction and cosmetic surgery go hand in hand.
Okay.
As a plastic surgeon, we need to know that we have to be a reconstructive surgeon to be a good cosmetic surgeon.
Yeah.
So we need to have our reconstructive basics right, and then we are good at cosmetic surgery. Okay. Yeah. So
It's amazing because you just want to enhance people's lives, basically.
It
You
is
want them to
enhancing.
live a better life.
live a better life,
Yes.
and we enhance their self-confidence. For
Yeah.
so many of them who come to us with like this, and after the surgery they're like big smiles, So
Okay.
cosmetic surgery goes beyond vanity in today's day and date. I truly believe in it, and I believe that it's a mix of reconstruction, enhancing a particular feature, restoring it, reshaping it, or just refining it,
Right.
as how you want to call it.
So I'm going to ask you one controversial last question.
Okay.
So what is the weirdest request anyone has ever come to you with? Like, oh, I want to do this. And you're just like, no, not at all.
I cannot say it on your podcast.
Or, okay, let's not talk about
Okay,
this. Yeah.
Like a private area
Right.
changes in that. I can't do it.
Yeah. Oh, but
Pertaining to men.
oh,
A weird
really?
request. I mean, if you can get the gist of it. But yeah, that's really, really not that.
Enlarging some organs.
Some certain organs which need, strengthening, lengthening.
Not possible.
I mean, there are surgeries which are there in our, at the back of our hand, but
Right.
they're not always foolproof.
Right.
And they're not always successful.
Yeah, we shouldn't laugh. I guess it's
Uh,
there.
Yeah,
up to
it's
them.
obviously, see, again, you don't know the request. It could be weird for someone, or we could laugh about it.
Yeah.
But someone could be medically suffering from a problem.
Yeah.
As I said, when people say, why did that person have to do this surgery? I say for that person,
It was important.
it was important.
Yeah.
For them, it was in their mind,
Yeah.
not able to live with that feature. So as when we talk, and I will just put it straight out there, when we talk about body positivity and the rise of it
Yes.
and body shaming,
Yes.
I don't think we should body shame anyone for doing or not doing a surgery.
Yeah, that's also body shaming. If
That is
someone
also,
is,
if someone has done it, also you're body shaming it
Yeah.
for doing it.
yeah.
If Shushmita Sen wonderfully spoke in a particular interview, and I will quote her.
Right.
I will quote her when she said that if you are looking in the mirror, and you feel that you love yourself and you love the way you look, hats off to you. That's great. That's amazing. Be proud of yourself. Be the way you are. It does not matter. And don't allow anyone to tell you the way you are. That's amazing. But if you feel there's something that you're not able to look at, and you really want to change about it, it is one life, it is my body, it is my life, my face, and I would like to see myself like this, then go ahead and do it.
Yeah.
And when I heard Shushmita Sen say it, and I feel
get
that should go out to every man and woman. If you like the way you are, absolutely stay there and, be the way it is.
Yeah.
But do not also body shame someone or judge someone if they believe that they would like to do something to change something about themselves.
That's also
whatever.
body positivity.
And that's also body positivity. I will do this and still be happy.
Yeah.
I will not do this and still be happy. What's important is to be happy with oneself. Whether you do the procedure, don't do the procedure. If you do the procedure, also make sure that makes you happy. And you are completely well informed when you are doing the procedure, and make sure that it will make you happy. Okay. Then it's a wise decision. And if you're not doing it, be happy with yourself, either which ways. And then don't trip about it.
Okay. Thank you so much for coming on.
Thank you so much.
You've answered so many questions so beautifully. It was such a pleasure to host you. Thanks again for coming.
It was my pleasure. And these are things that we talk less about.
Yes.
We're always in our hospitals and our clinics and stuff doing surgery, and I'm always there. It was let out of so many things that I loved speaking about.
Amazing.
And nice to sit and have the chat. And you brought out all the important, crucial elements. And I hope by the end of this podcast, we are able to bust certain myths, make you a little open to plastic surgery, and make you people feel that plastic surgery is okay. It's not too bad. Definitely not dangerous. It is safe when done right.
Yeah.
And I think we should no more keep these taboos in our mind. And I think we should get out of taboos.
Yes.